Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and I'm a PT assistant. Today, I am interviewing Rick Olderman, who is a physical therapist, on different back pain questions that our audience had for him. We are going to talk about things like sciatica, stenosis, disc herniations, and many more. So, without further ado, here is Rick. Okay, the next question. My lower back tightens and hurts even when I stand for a short time. What's likely to be the cause, and what can I do to alleviate it?
Yeah, so this kind of goes in with all of our other back things. So what it sounds like they're saying to me, and correct me if you think I'm wrong here, Mike, is that they're saying it hurts when they stand, which means that it probably doesn't hurt when they're sitting.
Right, that's what I'm assuming.
Yeah, so it's the act of going up and standing that's causing the back to hurt. All right, and maybe that back pain is relieved after they've been moving around a little bit. So my guess is that when they stand, and this is where a lot of people stand, is that their feet are parallel like this from sitting in the chair. And you know, they're getting up out of the chair. Let's see if I can bend this. And what they do is they stand up with their legs and then they arch their back like this to come up. So their legs straighten first and then the back straightens. And it's that back straightening like this, where it's that excessive arching of the back that's causing probably that momentary back pain. So what I would say is when you get up out of a chair, first, slump your back a little bit and maybe stagger your feet just a little bit. So you're biasing one leg to work harder than the other. And then when you get up, instead of, straightening the legs and then straightening your back, keep the back slumped as you're pushing up through your legs. And then only when your legs are straight do you start articulating your spine from this arch, and you flex one vertebrae at a time to come up instead of arching the whole spine to come up. If you articulate the vertebrae one vertebrae at a time to come up, then what that's going to do is, again, it's going to disperse all the force that's occurring at the junction between an immovable area and a movable area, and it's going to disperse it among all of these movable areas instead of just that one. So that would be my recommendation. And then, of course, I go back to my trusty old stretch your thigh muscles, because if they're tilting the pelvis forward and locking the pelvis in that forward position, your back is fighting against that pelvis that's locked forward because of the thigh muscle tightness. And so it's undergoing more arching stress than it really needs to go through.
Yeah, I don't know why I'm picturing this person using a walker, but they didn't say they did.
Yeah, same thing. Yeah, so if you have a walker, typically if you watch an older person stand up, they have their walker here and they straighten their legs first and then they try to come up like this. And that's exactly the pattern that's causing the pain. What they need to do is keep their spine rounded as they're straightening the legs and then come up at the very end, and that should feel a lot better.
All right. Well, thank you for joining us again. Where can people find more information about you at?
If they go to rickolderman.com, I have lots of free stuff there. I have some blogs. I have all my home programs, my practitioner training program, and there's a contact form there, of course, for me that you can use to reach out if you like.
Okay, perfect. Well, thank you for joining us.
My pleasure, Mike. Thanks for having me.